Welcome to our second episode of Physio Learning Hub. In this video, we are going to learn about regional interdependence. Regional interdependence refers to the idea that dysfunction in one area of the body may contribute to symptoms in another, seemingly unrelated area. It reminds us that the body functions as an integrated system rather than an isolated part. What is regional interdependence and why is it so important in the examination model? It is all connected. Important during history taking and objective examination. Aims and objectives. This treatment strategy aims not only to resolve current symptoms but to improve general function and decrease the probability of recurrent long-term issues. It may add a clarity to the patient's clinical picture and guide subsequent interventions and further avoid recurrent clinical admissions. The 9-dot problem. The 9-dot problem teaches us to think outside the box. Just as a solution requires moving beyond artificial boundaries, clinical reasoning often requires us to look beyond the painful area. Regional interdependence. A musculoskeletal examination model whose time has come. A patient may report low back pain that later develops into neck pain. Such presentations remind us that symptoms may be linked through the kinetic chain rather than existing as isolated problems. Imagine this situation. Doctor, I had a lower back pain a week ago, then the pain went through the spine and 2 days back it turned into severe neck pain, which I am suffering from even now. What evidence? Research has shown that patients with low back pain and knee complaints often improve when treatment is directed at the hip. Similarly, lumbar interventions can improve hip and knee symptoms. Regional interdependence is divided into 3 quadrants: front quadrant, lower quadrant, and upper quadrant. Regional interdependence. Lower quadrant examples. Positive relationship between the low back pain and knee arthritis. Positive association between pes planus and low back pain. Positive relationship between anti-impairment and low back pain. Hip impairment may contribute to knee injuries. Greater navicular drop and dorsiflexion associated with patellofemoral pain. Hip impairments in knee injuries. An element of counter-pelvic rotation as the chest moves forward on the opposite side. This rotation is produced at the spine and is often referred to as spinal engine. Runners with a restriction of hamstring or shoulder, when examined, it may be found that there is actually limitation in rotation of the pelvis causing the problem. Gluteus medius role in knee injury. When you lift your left leg, your right gluteus medius contracts in order to keep your body from tipping towards the left. Weakness of the gluteus medius allows your pelvis to drop and your knee to dive inward when you walk or run. This places tremendous strain on hip and knee. When kneecap is forced out, causing it to rub harder against thigh bone, creating painful irritation and eventually arthritis. Cause right gluteal weakness. Effect will be left side pelvic drop, femoral internal rotation, knee valgus, tibial internal rotation, and foot pronation. Regional interdependence with gluteus medius. Downstream, a no-knee position leads to ligament injuries and additional stress on the arch of your foot, eventually leading to plantar fasciitis. Upstream, weak hips allow your pelvis to roll forward, which folds your spine into sway back posture, leading to low back pain. Regional interdependence and plantar fasciitis. Combination of hip strengthening and manipulative therapy for treatment of plantar fasciitis. Clinical evaluation done by numerical pain rating scale, pressure pain threshold. On palpation, proximal insertion of the plantar fascia, plantar medial heel. 10 sessions of hip strengthening and manual therapy within 3 months. Manual therapy includes passive joint mobilization, Maitland and Mulligan mobilization techniques, neural mobilization of tibial nerve, stretching of plantar fascia and triceps surae, and soft tissue release. Regional interdependence and upper quadrant examples. Thoracic spine pain and dysfunction associated with lateral elbow pain. Thoracic spine interventions can alter shoulder pain. Regional interdependence on shoulder. Shoulder pain. The prognosis is poor and recurrence rate is high. 1 to 4 individuals with shoulder or neck pain will experience at least one episode of recurrence within 12 months of onset. Interventions on cervicothoracic spine for shoulder impairments. Several studies reported improved outcomes with shoulder following manual therapy on cervicothoracic spine. The function of the shoulder is highly dependent upon the relationship between scapula and thoracic region, as the muscles for shoulder actions are present in the thoracic region. Research has demonstrated that significant correlation between hypermobility in cervicothoracic spine and neck and shoulder pain. Thoracic spine and shoulder impingement. 56 patients, 40 males and 16 females, underwent standardized shoulder exam followed by thoracic spine, cervicothoracic manual mobilization techniques. Outcomes were measured after 48 hours using NPRS and SPADI. NPRS with near impingement, Hawkins, resisted external rotation, there was significant reduction. Treatment for shoulder impairments. Cervicothoracic manual therapy includes thoracic manipulation, soft tissue release. Thoracic manipulation includes thrust and non-thrust manipulation. And the shoulder rehab program includes therapeutic exercise and pain relieving modalities like TENS, laser, ultrasound, etc. Regional interdependence and neck pain. Examination model includes subjective assessment, objective assessment, range of motion, MMT, further assessment of thoracic spine, functional scapulothoracic joint, middle and lower trapezius, have no longer force generation to provide necessary movement for elevation, pectoralis minor activity, overactivity of pectoralis minor lead to anterior tilt and downward rotation. Neck pain and physiotherapy treatment. Rehabilitation program includes pain relieving modality or soft tissue release followed by therapeutic exercise. Therapeutic exercises include neck mobility and exercise strengthening regimen. Regional interdependence techniques include thoracic spine and scapulothoracic mobilization, taping for thoracic spine in order to correct kyphotic posture if present. Regional interdependence in T4 syndrome, a pattern that involves injury to facet or disc at T4, affects nerve root at that level, paresthesia in hand due to poor posture and excessive bending or lifting. Symptoms: stiff in morning, sitting in one position for long periods of time is difficult. Mobilization of upper thoracic vertebra at T4 region eliminates hand paresthesia. T4 syndrome and treatment. Shoulder blade squeezes, chin tucks, thoracic thrust manipulation at T4 region. Regional interdependence on lateral epicondylitis. Cleland et al. Found that patients who received manual therapy procedures targeting the cervical and thoracic region in addition to treatment of the elbow achieved more favorable outcomes than did those patients who received management of the elbow only. Regional interdependence for carpal tunnel syndrome. Treatment was directed at increasing mobility in the cervicothoracic joint and upper thoracic spine. along with decreasing neural tension that resulted in a decrease of this patient's symptoms at the carpal tunnel. Thrust manipulation should be applied with the patient seated, followed by therapeutic exercises like wing up breathing 30 times, sessions 1 to 5, cervical retraction 10 seconds, 10 times, sessions 1 to 5, 3-finger flexion, flex the cervical spine to 3 fingers length from chin to chest, wrist flexor stretch, side bending, median nerve flossing, perform 3 to 5 sessions, middle and lower trapezius strengthening, prone T for activation of middle trapezius and Y for lower trapezius activation. Regional interdependence and carpal tunnel syndrome, cervical and thoracic spine mobilization alleviate carpal tunnel syndrome treatment plan, tendon glides, mobilization of carpal bones, soft tissue mobilization and nerve mobilization. Carpal tunnel syndrome treatment plan. Treatment may include cervical retraction exercises, median nerve flossing, that is a neural mobilization, trapezius strengthening, tendon glides, carpal mobilization, and soft tissue release. Let me conclude by saying that regional interdependence reminds us to assess the whole patient rather than focusing only on the painful structure. The body functions as a connected kinetic chain. The key message is simple. The source of pain is not always the site of pain. If you have any doubts, please contact us at physiotutor679@gmail.com. Please check out our new Instagram account, physio.learninghub. Thanks for watching. Don't forget to subscribe, like or share this video.